All right, welcome back. Yes, indeed, we've got the Honorable Coordinating Minister of Health and Social Welfare is here with us this morning, Professor Ali Pate. Good morning, and thank you for coming on today.
Thank you for having me.
Yes, indeed. So much as we're indeed glad, the country is indeed glad that the children have been released, and so we're hoping that the authorities will do what we have to do to ensure that those kind of things don't happen again. But an equally important subject matter is cancer care in this country. I'm just going through some of the data, and it's really shocking. I saw a poll that was published in 2023. It says 6 in 10 Nigerians do not know causes of cancer that they face. And I see another one, which shockingly, I know this is really sad. It says we have an estimate of 72,000 cancer deaths which occur annually in the country. And there are several other data which is quite scary, but it's needed if we need to move forward to analyze and see what can do. But you're here to talk to us about federal government seems they want to do something about this. You signed an MOU. So tell us, what is this initiative that government is embarking on for oncology?
Yes. I think it's really fantastic news that our children in Kuriga have been released, and I think it tells a lot about what government has been doing to ensure security is improved. On the cancer issue, we know that the fastest growing segment of the burden of disease of Nigerians is non-communicable diseases. Not only infectious diseases like malaria, TB and others, but we're having fast growing non-communicable diseases, including cancers. And as of 2022, WHO data showed that 127,000 cases of cancer occurred in Nigeria, almost 80,000 deaths. And that's a risk that all population in this country face. 1 in 8 Nigerians have a lifetime risk of having a cancer over the lifetime that they have, based on WHO data. 1 in 10 men and 1 in 7 women. The top cancers are breast cancer, which is the most common form of cancer, prostate cancer in men, cervical cancer in women, colon cancer, and other malignancies that exist in our population. And so this administration, in the second pillar of the agenda, the health sector renewal agenda, which was to improve population health outcomes, began to look at this very critically from the point of view of organizing to understand sort of the patterns of cancer and how best to respond. So for instance, a cancer registry, we don't have one. Late April, we'll have an online cancer registry, which we will then connect with a regional registry with the African Network of Cancer Registries.
How will that work? Are people supposed to log on if they have cancer or if their loved ones have cancer?
So data on cancer is very limited in terms of the qualitative data that will guide treatments. And so pathological reports from samples taken, confirmed cases of cancer will then be uploaded, so that it will be valuable for researchers, for clinicians, to see also the outcomes over time so that adjustments can be made.
In other words, the medical centers will be the ones responsible for that.
Exactly. It's not popular. It's really for specialized purposes. Now, the treatment side is what we've tackled on Friday. In collaboration with NSIA and with the support of Mr. President, we signed an MOU which will expand in a very significant way, in fact, in an unprecedented way, cancer infrastructure and equipment in 6 federal tertiary hospitals across this country, so that they have the linear accelerators, the brachytherapy, and the diagnostic equipment. Believe you me, there are times where there's only one linear accelerator functioning in this country. You have to travel from one part of the country to the other. And many Nigerians fly to Egypt, to Middle East, to other places for cancer therapy, for radiotherapy. Now we're going to solve it with the MOU that we signed with the NSIA, with the approval of the president, to go directly to the OEMs, the original equipment manufacturers, to secure those critical equipment, to build, to embed them within the hospital infrastructures, alongside the training of the personnel and maintenance arrangements for those cancer therapy equipment, so that over time, Nigerians can be able to access those services that they need in the event that they have cancers. In addition to that, we've restructured the Cancer Health Fund, which had existed in the past, which is supporting the poorest and vulnerable to cover the cost of cancer care. It was housed in the Ministry of Health. It has been there for some time. We restructured it, transferred it to the Nigerian Institute for Cancer Research and Treatment, NICRAD, so that we provide a safety net for the poor Nigerians who cannot afford the high cost of cancer care in this country.
So, pardon me, how is that supposed to work now? If they are diagnosed, is it at what point? What are the stages, and how can they access the funds?
So, until now, I mean, most folks, given the paucity of insurance, fee-for-service is how people pay for the care that they need.
Yeah.
But this effort is to reposition the Cancer Health Fund so that for the vulnerable groups, through the hospital where they are diagnosed and they are prescribed the medications to deal with their cancers or the therapies that they need, the payment for that can be subsidized using a pool of public resources, but based on need. And that's the idea of the Cancer Health Fund. And that is now transferred to NICRAD, and I believe that we will expand that over time. So that's on the therapy side. But there are other elements of it. There is a research side, there's also the prevention side. So the prevention, in fact, is going to be also very critical, so that early diagnosis. When we talk about the HPV vaccine to prevent cervical cancer, that is to prevent our girls from getting cancers when they're older women. When we talk about hepatitis B vaccines, that is, in a way, a preventative vaccine for liver cancer over time, because hepatitis B contributes to cause of liver cancer. Screening, routine screen, pap smears for women. Early diagnosis, generally, having the ultrasound capability, even the awareness, like you started on, are also important elements for the preventative approach, so that we bend the curve in terms of cancer.
Prof,
yeah.
One thing that we will notice over time, much as, yes, this is a good initiative, but chances are that, in fact, the cases we've seen is people caught this at a very late stage.
Yes.
So they just go in and find out, oh dear, they have this, it's either in stage 3 or 4, and sometimes it's too late.
Yes.
So is there any plan? What are we doing? Is this also going to address the ability to properly diagnose?
Yes.
Because in many cases, even as little as malaria, well, it's not little, but malaria is misdiagnosed in many cases. What are we doing to address that?
So expansion of the diagnostics capacity is part of this health sector renewal agenda that we have. And I think you will very soon hear the groundbreaking of at least 10 health infrastructural projects in the country, 8 of which are diagnostic centers. This is aside from this specific cancer treatment infrastructure that we have. This was approved also recently by the president, and we're looking forward to do that alongside with the NSIA, so that Nigerians have good cancer diagnostic, not only cancer, but other diseases, whether it's cardiac catheterization for cardiovascular disease, whether it's CT scan and MRI, or other more sophisticated diagnostic tools or PET scans, so that we are more accurate. And then the research side, because in partnership with some well-renowned institutions, we're looking towards bringing in capabilities for genomic and precision medicine, so that you are able to be precise, not only the macro picture of what cancer, but what is the molecular biology of that cancer, so that it can be targeted. So Milken Institute in the United States, Mayo Clinic, you will hear in a couple of months, signing of an MOU with NICRAD, so that element is also. So not only having a registry, expanding the treatment infrastructure and the capability, the research, which will also build the talent of those Nigerians that are here, the experts, and then the preventive side. So it's a holistic effort to begin to address an increasing burden of morbidity and mortality in this country.
Do we take it for granted that the treatment, medication aspect of it is going to be insulated from any form of adulteration whatsoever?
Well, a strong regulator is very important to protect us, whether it's for infectious disease or whether it's cancer. And that's why NAFDAC is very vigilant, and we are stressing to NAFDAC to continue improving their regulatory capacity as an institution. So the cancer medicine, at the moment, for instance, some of the cancer therapeutics, they're not produced here. They're imported. So over time, can we also begin to domesticate some of those, whether they are biosimilars, for instance, which are useful in cancer therapy? That's why the third pillar of our agenda is to unlock the healthcare value chain. So if you just understand the logic of this health sector renewal agenda of the president, the second pillar is on health outcomes, and cancer is a key part of it. But the third one is also the value chain, which means that we need to get to the point whereby we are producing some of these things here. And it will not be overnight, because we haven't done it for some time, but we will start. And hopefully Nigeria will be on a different trajectory, and as mentioned by the president. Yeah.
Well, I sincerely hope that, medical personnel will be carried along, to be made aware of whatever it is that government, there will be like a real intentional drive to keep them aware of the steps that government intends to take with regards to cancer. Because more often than not, if you visit a medical facility, especially a government-owned medical facility, you begin to find that doctors, feel compelled to help patients pay for certain treatment or pay for certain tests that need to be done especially for vulnerable people. And I think that's something that needs to be looked into. However, you mentioned visiting original equipment manufacturers, OEMs, you said, for equipment, etc. Now, some people have argued that oftentimes it's not that government didn't buy the equipment. The equipment might be there, but as you've mentioned, lack of personnel sufficiently trained to be able to operate it, sometimes a lack of electricity to get the equipment working, and then sometimes the equipment are outdated. So I do not know if we're going to be having conversation enough with this OEMs to say, maybe we too can have tests, because there's some facilities that, are the places where they send the equipment to be tested first, before they even ask them to buy. Do you think we could ever get to that sort of arrangement where Nigeria becomes one of the destinations where equipment is sent to first for testing before, purchases are made?
There's so many issues, but you have to start somewhere. Without the basic infrastructure and equipment, even if you have trained personnel, it will be difficult for them to function. So this first step with NSIA and going to the OEMs, in fact, resulted in a huge discount, almost 30% discount in the cost of some of those equipment that are produced by the OEMs, which is significant savings for government, especially at this time. Now, it also includes the maintenance agreement so that this equipment will be maintained over time, as well as a training of personnel to use those equipment. As to the health workforce issue that you raised, cancer care requires not only the professional oncologists, but there are also nurse oncologists specialized in cancer care, and other cadres, radiotherapists, medical physicists, a whole lot of medical personnel that are needed. We are on this path to provide the enablement for them. We don't have enough. We don't have enough oncologists in this country. But with this infrastructure, it will encourage more of our physicians to train, more of our nurses to train here with this equipment, and hope that they will not walk away. And those who have trained abroad come back into the country and serve. And we have begun to see the willingness of some of our experts. You just need to see Marcel Ruth Hospital in Lagos, where we see a fantastic, very well trained, experienced oncologist deciding to move back home and set up a cancer center in Lagos. We're seeing that trend beginning to happen. Now, with this enablement that we've now begun to provide through Mr. President's approval, I believe that the health workforce itself will be encouraged to stay, to serve, to be involved in research, learning, and to contribute to this country's development. And over time, other countries, even in the sub-region or in the continent, we are seeing them possibly coming to Nigeria to have care, because we'll have world-class institutions with well-trained personnel in this country to serve Nigerians, but potentially to serve other people.
I really want to be optimistic. I really want to share, the vision. And I see the picture you're painting, but I'm wondering when that will eventually materialize. What I want to know is what hospitals, because I know before now, a number of hospitals, government-owned hospitals, had been earmarked centers of excellence for cancer care. One of them is a national hospital here in Abuja, and I'm not giving any prejudice to the kind of care that the doctors, the personnel in that hospital provide. They really do their best within the means that they have, but they could be supported with so much more. So what facilities are you looking at now to say these are the areas we're looking at, these are the ones that already have some capability, and maybe with some improvement and some support, maybe in the next 2-3 years, we should be seeing the sort of, service centers that we desire?
I think we've not done as well in making sure Nigerians are aware of the high quality of what we already have. And you need to go to Lagos University Teaching Hospital Oncology Center. Luth. Oh. They have a really fantastic oncology center, 99% uptime, receiving patients from all over the country and the sub-region. You need to go to University of Maiduguri Teaching Hospital to see infrastructure that has been built and equipped and is providing services. Now, there are others in the private sector. I just mentioned Marcel Ruth in Lagos, which receives patients even from the sub-region, because the Nigerian who is running that she's run in NHS. She's treated, you will say, world-class Nigerian and a world-class institution in Nigeria. We need to begin to believe that all of these things, we can make them here. And the 6 federal teaching hospitals that we are now going to invest in is Federal Teaching Hospital Katsina, or the University Teaching Hospital in Zaria, Jos University Teaching Hospital, University of Benin Teaching Hospital, University of Nigeria in Nsukka, and additional oncology site at Lagos University Teaching Hospital, because I was at Luth and I could see even the existing oncology center was being stretched to capacity because of demand. They see 150 cancer patients a day, maxing out all the 3 linear accelerators they have. So there is a lot more that is needed. We're at a very low base. We're beginning to move. So yes, the psychological barrier to say, oh, things have been bad for so long, they can't change. We're saying that, in fact, you can start in a focused manner, start somewhere, start to build in a determined way, and co-opt others, co-opt other Nigerians in the diaspora, those that are here, that are well-trained. Encourage our younger ones to get into these kinds of fields. Support them, not only the oncologists, but also even the medical physicists, the radiation, the radiographers, and other technicians that are necessary, and our nurses. And to make the ecosystem really function, and for Nigerians to begin to feel that, well, you don't have to spend millions of naira going somewhere else to get a care that you may be able to get here. So my call to Nigerians is to look domestically, because some of our teaching hospitals are doing a really great job.
All right. I know there's several things were just coming to mind, you know, when you were highlighting some of these things, right from the environment, you know, the moment you walk in, how you're attended from start to finish. It's a complex whole. I was just wondering what your big picture is, a vision that you actually do have, or that the country has for this cancer centers, because lots and lots of Nigerians, as you know, going to other countries, India, several things, because of affordability as well. I mean, they compare that to the States, it's just really a very high side. So is there any incentive on the part of government to encourage probably private sector either to collaborate or get in there and ensure that they have a lot of these other centers to make it easy for lots of people to access it?
So this publicly financed expansion of the cancer infrastructure and equipment that we have, our vision is in the 18 to 24 months, you can walk into any of those 6 facilities. And if unfortunately you or someone else close to you has cancer, be able to have the therapy that they need. And that is one part of the ecosystem. But there are other investments that we are going to be making, and some of which are coming from the private sector, some of which from public resources, that would make the environment such that folks can be able to get the care that they need. That's a start, because it's a huge deficit. I'm not saying that we'll finish solving all the problems that exist in the Nigerian health system. But if you listen carefully to the President's Renewed Hope agenda, I think he has a vision of a prosperous, productive country over time, and that health is going to play a major part in that. And we're on this path, block by block by block. While we're fixing primary health care on one part, improving our hospitals on another part, and having specialized care, whether it's cancer care, whether it's nephrology for kidney diseases or other or cardiovascular disease, because these are also a group of diseases that are increasing in our country, as well as fixing our health insurance program so that Nigerians are able to afford some of it.
That's a very, very important part of the entire thing, rather than out of pocket, which is very scary for lots of people. Ayo, go ahead, please.
Well, thank you, Chamberlain. I mean, the minister has spoken to the affordability the other time, and that's definitely a huge one. And as you said, Honorable Minister, good to see you again, by the way. You mentioned the fact that we probably haven't done enough to let people know the capacity that Nigeria has in dealing with these specialized cases as opposed to going abroad. What's the plan concerning that issue of awareness for Nigerians to, one, know, and to build enough confidence to say, I'd rather stay in Nigeria and get this done than go abroad?
I think the mindset shift that is required, it requires us that are in positions like we are in the Ministry of Health and our chief medical directors to communicate to Nigerians, and you members of the media as well, to ensure that Nigerians see the positive side as well. It's not all about what is not working well, but what is it that we can make to work better in this country. And as we do that, and as our hospitals improve, people themselves will experience better quality care. I have had stories of people who have been all over the world and they have come back. In fact, just 2 weeks ago, someone who has traveled all over Middle East started his cancer therapy in Abuja and was very happy. Was not spending the humongous amounts of resources that they would have spent in other second or third rate facilities, and they're getting very qualitative cancer care in Abuja. And so there are many of those that I hope people will begin to share, so that the mindset of Nigerians turns around and begins to believe that we can also do what we're going to see in other countries, that we can actually make it here. And our health workers here are fantastic, and many of them that are very well trained. They set the guidelines in the African region, for instance. For 2 consecutive terms, the chair of the African Research and Committee that looked at guidelines for cancer care was a Nigerian. It's a Nigerian, and there are many respected Nigerians in oncological practice, in other fields of endeavor, who are there and contributing. But we just don't seem to want to believe in ourselves.
Well, Honorable Minister, one of the things that scares a number of people when it comes to going to public institutions, particularly public hospitals, including Luth and several others that you've mentioned, is the attitude that they sometimes get from healthcare professionals who interface with them, from the very reception and all of those things. So sometimes people wonder, how can I be treated like this when I'm looking for better health? I don't know if that is something of concern, though generally, but particularly in such specialized cases as you're talking about.
We're working with chief medical directors, the chief executives of our hospitals, to begin to train and enforce this idea of better interpersonal communications, so that the personnel, who are obviously also very stressed because of different reasons, and I'm not going to take that away, but at the same time to ensure that in fact we treat each other with respect, with dignity, and we serve the population. Health is a very unique product. You can go to a place and it may look very nice, but you may end up buying poor quality care without knowing, because there's asymmetry. The expertise is not like a hotel or an airline. It's a very different kind of commodity, and as a consequence, folks who go outside this country go to other developing countries in the name of getting care abroad. But when you look carefully at the quality of care that they receive, it's actually abysmal. I've seen some of those in the Middle East, and I think if people can be a bit more patient, and while we work with the health workers and our leaders in the teaching hospitals and other levels of the healthcare system to improve the way we treat each other as Nigerians, I think people will begin to experience quality of care that will be commensurate, if not much better, than what they may experience in other parts of the world.
Honorable Minister, you spoke about infrastructure the other time that can support a good healthcare provision system. Malkwe asked a question around electricity the other time. What's the plan around that? First in the provision of it, and then even in paying for them. The UCH in Ibadan, for instance, is one that we understand that the disco there has disconnected the organization because they owe something in the region of 500 million naira in electricity debt. So on the one hand is provision of the power, on the other hand is the affordability of the power for health, for public health institutions. What's the plan around that one, especially in the light again of cancer care?
It's a major challenge. The issue of power, it cuts across. It's not health, but it's across sectors. But what we're seeing is that many of our facilities spend 50, 100 million a month from their internal generated revenue on power, on diesel. And that's a big challenge in terms of running the hospital operations, but they are developing creative ways around it, and we're supporting them. This year, in 2024, the Federal Ministry of Health has put significant resources on solar as an alternative source of power. If you go to University of Maiduguri Hospital, you'll see 24-hour power supply to their cancer center from a combination of the regular on-grid power supply, solar, which they've solarize all the parking lots near the cancer center, as well as connection to an independent power plant that is in Maiduguri. You're seeing some that are discussing with us to connect to industrial power lines, although they are being charged at industrial rates, and we're now going to be making the case that, look, they should not be charged industrial power rates so that we can reduce the burden on them. Overall, I believe that the power situation in the country will improve as part of the government's own efforts. And as that happens, it will be a lot easier, the burden on these facilities. And I know that my colleague, the Minister of Power, is working very hard to ensure that the power situation is improved so that many of our facilities will have this burden lightened for them. So we're working hard from all angles to ensure that at least the power is there. And for this infrastructure that we're investing, the power is also factored in how they will ensure that they are up and running.
Okay, just one last one from me, Honorable Minister, is the collaboration with states. As we have specialist hospitals by the federal government, so do we have in some states. Is there any collaboration in that regard, particularly in the area of this oncology care that we are talking about? I know that Lagos State government, for instance, has a plan around some kind of oncology initiatives, as the federal government does. What's the plan for the collaboration so that the people get the care they need at that collaborative level and hopefully even help reduce the costs on the people, as you've said?
So Lagos is a unique state by itself, and I can understand how they have a very elaborate plan. Oncology is a very specialized service. You need the infrastructure, but you also need the people, the specialized people. It's also a function of volume. And so the federal government is stepping in this way for a super specialized service. And there will be other private sector players who will also be doing similar. But I think the compact that we have signed with the states, at federal government and states, is at the primary healthcare level, so that they also invest in a complementary. Mind you, we're looking at the entirety of the healthcare system to serve Nigerians' needs. There's the basic healthcare, which every Nigerian should have access to basic healthcare service, whether it's malaria, whether it's pregnancy, whether it's immunization, and whether it's basic treatment of hypertension and diabetes, and cancer screening, which the NICRID is working with the primary healthcare to ensure that. And we have a compact, which the President oversaw us to sign as part of the unveiling of the Health Sector Renewal Initiative in December. That compact guides what states ought to do to complement what the federal government is doing.
Okay, Honorable Minister, let me just quickly take you up on the amount of money which the federal government is allocating to this oncology care, 37.4 billion naira, we hear. Now, for those who will be saying, look, this is a non-communicable disease, this is sometimes an elitist disease, not exactly true, but there are diseases that affect a bigger generality, a bigger population, and maybe we don't even need this much money to be able to take care of them. How would you respond or justify the amount of money we're investing in cancer care to them?
Two main ways. For the 120,000 Nigerians that got affected by cancer in 2022, and for 80,000 of them who lost their lives, there's no amount of money that will be, you can't compare You cannot monetize the value of those lives, the pain to their families, to their wives, to their children, to their relatives, to their neighbors, to their friends. So long as there's something we can do, it's important that we prioritize that every life matters. And I think from our perspective, this is not the only investment we're making in health. We're making huge investments in primary health care. We're investing in cardiovascular care, but we also have to attend to cancer care. This is something that Nigeria should have done long before now. It hadn't. The investment that we have now picked, initially government had appropriated 17 billion, but for many reasons, there are lots of issues before we came. We came and in line with Mr. President's directive, decided to take the bull by the horn, mobilize the resources, get it appropriated, and get to NSIA and get them to negotiate with the OEMs so that we can get going on this.
How soon should we begin to see this materialize? Well,
I think within 18 to 24 months, the facilities will have been completed, equipment on ground, people trained, and the maintenance agreements in place, because the bunkers have to be built, the equipment has to be, they're not sitting on the shelf. But you have to commit, and that's why we went through NSIA, because there's an existing procurement process and contract with these manufacturers to say, look, let's just do it. And this is something that once you do it, it will take decades riding on the back of it, and then you can do something else. Next year, it may be some other aspect of our problems that we can tackle. But there's no amount of money that can equate to the life of someone who suffers from cancer. Of course, we should prevent, and that's why, if you recall, in October, we launched the vaccination against cervical cancer, HPV. It's primarily to preempt, so that in the future we have less of that. That's why federal government is investing in hepatitis B vaccine, so the liver cancer becomes less over time.
One more question for me, which is about support. You did say that some support will be made available to those who need treatment. And I think the funds will be housed, I can't remember, was it in NICRA also?
NICRA, yes.
Yes, so how do people get access to this fund?
So it's a fund that had existed before, but it hasn't functioned optimally. It's called the Cancer Health Fund. So we have restructured it to be placed at NICRAD, and over time to expand the pool of resources so that those who are indigent, who are diagnosed with cancers in the hospitals that are participating in this, for their prescription, for their drug cost, they can have, there's a process in place to apply, and once that is approved, validated, so it is for cancer, goes to the intended purpose, that in fact the hospital will be reimbursed, so that the burden is off the shoulders of families and those who are affected. It's a start, and we need to do more to protect the poorest and vulnerable. There are many who are already paying tens of thousands of dollars for cancer treatment, sometimes importing the medication, almost always importing the medication from abroad, or going abroad to get the treatment themselves. Those can't afford it. But there are many Nigerians for whom cancer is almost like a death sentence because they cannot afford the care. And so the Cancer Health Fund is one way. And the idea is that even the private sector, philanthropists, can contribute to that, because we have to take care of each other. And it's not just everyone for him or herself. That we should be concerned about those who cannot afford things that can save their lives as well. So the Cancer Health Fund is structured in that way. And in fact, you can help us amplify. We've got many wealthy Nigerians who can contribute to the Cancer Health Fund, to cater for the funds. And some are already doing that quietly through hospitals and through friends of hospitals. But I think using the Cancer Health Fund is one way that you can target it to ensure those who really need it get it.
Well, yes, Prof. I mean, why not? I mean, because sometimes, you know, with some of these things, it's not really about how much people can gather. Sometimes it's how much you can, quote, scatter. You need to also reach out. There are several people who need some sort of intervention, help, or the other. So we have to thank you for coming on. Professor Ali Pate is the Coordinating Minister of Health and Social Welfare. All the best to you and the team. We hope that we'll keep doing whatever we can to get Nigerians healthy. Thank you for coming on today.
Thank you very much.
All right, so we will be back in just a moment. Stay on with us.